Good morning. Thank you so much for joining Forge Breast Cancer Survivor Center for our coffee conversations. We're very excited to have Dr. Jahan here to talk about stage 4 breast cancer and just asking some of those need to know questions to get some more clarity. I really appreciate you taking the time out today to do this. As I mentioned before the recording, this is a topic that's very close to my heart, having lost multiple aunts to stage 4 breast cancer. So I'm really excited to learn more and ask some questions myself. But before we get into the questions, Dr. Jahan, if you could tell us about yourself, all of the things that you've done in your career, and just kind of how you've landed in this work.
Thank you, and it's my pleasure to be here today. I'm one of the breast medical oncologists at UAB. I started at UAB in July of 2022. Just before that, I did my breast-specific fellowship at Mayo Clinic. Originally, I'm from Bangladesh, but I moved here in 2011 and completed all of my training at US. And my research focus, as well as clinical focus, is breast cancer. However, I have particular focus on metastatic breast cancer as well. And I have one focus of my research is drug development, but I have another interesting focus, which is sexual dysfunction or sexual problems in metastatic breast cancer patient.
Wow, that's really interesting. I look forward to kind of learning more about that as well. So getting into the general topic of stage 4 breast cancer, if you could just kind of tell us, what does that mean when someone hears you have metastatic or stage 4 breast cancer?
Metastatic or stage 4 breast cancer means that cancer has moved from the breast or same side axilla to other part of the body. Okay. So in general, like suppose breast cancer starts from the right breast. I'm just giving an example. And then it moves to right axillary lymph node. That will not be a stage 4 cancer. However, if that cancer has moved to other part of the body, like bone, liver, lung, or any other part we'll be discussing a little more in future, then it will be regarded as stage 4 breast cancer. Okay. So one important thing, actually two important things to remember. Okay. Suppose if someone has right breast cancer and that has moved to right axillary lymph node or armpit lymph node, it is not a stage 4 cancer. It will be either stage 2 or stage 3 or sometimes, but if it moves, suppose in the left armpit lymph node, that it will be a stage 4 cancer. Or it moved to the bone, it will be a stage 4 cancer. So any other part of the body except same side breast and armpit lymph node will be kind of regarded as stage 4 cancer. Okay. So one of the things that we notice sometimes patients get very, very apprehended is that sometimes you can read the pathology report and lymph node biopsy of the same side armpit lymph node is done and mention metastatic cancer there. It's not a stage 4 cancer. It means just cancer has moved from breast to that lymph node. But if it was from the other part of the body, suppose lymph node was taken from the groin or some other place and it was cancer, then it will be a metastatic cancer.
Thank you for that clarity, because we have been seeing a little bit of that working at Forge when we talk to patients or clients about, hey, what's going on and how can we help? Also, could you kind of talk about it? Are there different types of stage 4 breast cancer? I feel like that's a loaded question, but like for example, like inflammatory or whatever, like are there different types of stage 4 breast cancer?
Okay, breast cancer, yes, there are different kind, and why we divide breast cancer into different kind. It's important to understand. One of the reasons we divide is that we know now better than we used to know before. So we identified some of the targets like estrogen receptor, HER2 receptor, or some other mutation that we have treatment, we can use against those type of breast cancer. That
Mm.
was the purpose, to divide the breast cancer in different subgroups. In addition to that, the prognosis of stage 4 breast cancer based on what subgroup you have or someone has highly depend on subtype of breast cancer. Okay, so in general, currently it will be changing over time as we know more and more about breast cancer, but currently I can put them into several buckets. Okay, so number one bucket or most common type is actually estrogen receptor positive and HER2 negative breast cancer, which is the most common subtype of breast cancer in general. And close to 70% of the metastatic breast cancer will also be estrogen receptor positive and HER2 negative. Okay. The other bucket is HER2 positive breast cancer. Okay. So in the HER2 positive breast cancer, there are two groups. There are one group of people who are HER2 positive, but estrogen receptor or progesterone receptor negative. Okay. And there is another group of people who will be HER2 positive and estrogen receptor positive. Sometimes you will hear a name called triple positive. That means they are estrogen receptor positive, progesterone receptor positive, and HER2 positive. Okay. Then there is another group of patient called triple negative, which means that basically they don't express estrogen receptor, progesterone receptor, or HER2 receptor. Okay. And there is a new concept that is very applicable for stage 4 breast cancer called HER2 low. Okay, so they have slight or low expression of HER2, but they have some treatment that we can use, and we can elaborate more about that. So why we used these three biomarkers for dividing breast cancer, because we have medication that we can use against estrogen or progesterone receptor. We have medication that we can use against HER2 receptor. That is the reason that we divided breast cancer into different buckets. And their prognosis also very variable depending on what type you receive, people have. So that's the reason why we divide the breast cancer into different buckets.
Thank you so much. So how does someone, recognize symptoms that, hey, something is happening and it's more than what someone identify as just regular breast cancer? Are there any symptoms that could kind of help someone identify other than the mammogram and the PET scan? When should someone really red flag some things that they noticed?
Okay, it's a great question. So let me go a little bit kind of like backward. So like more around 2/3 or little more than that, metastatic or stage 4 breast cancer actually get like diagnosed as recurrent cancer, which means they had early stage breast cancer from breast cancer stage 1 to 3 before, and then a few months to few years or many years after diagnosis, they have diagnosis of stage 4 breast cancer. That actually include majority of the stage 4 breast cancer patient. But there are some patients who diagnosed with breast cancer as stage 4 breast cancer from the beginning with. That means when they get the diagnosis of breast cancer, they found that it has been already metastasized to the other part of the body. Okay. There is no major difference in treatment for these two groups. But why I brought it up, because if someone has already diagnosed breast cancer before, and if they develop any concerning symptoms that we'll be discussing now, then they shall definitely contact their oncologist or primary care doctor. And it's very easy thing. We just need to do a scan of that part of the body that is related to symptoms. So what are the symptoms people present with? One of the common presentation actually asymptomatic. They don't have any symptoms. Suppose someone did a CT scan or a MRI breast for some other reason, and then you find that something is in the liver, lung, or anything such, okay? And the second most common would be, suppose breast cancer has a tendency to move to bone. So bone is the most common site of metastasis for breast cancer. So some people starts to have pain. So joint pain in the hand or knee, which are very common. And cancer usually, not only breast cancer, any cancer do not rarely move beyond elbow and beyond knee. Okay. So if you have elbow pain or wrist joint pain or knee pain, which are very common, most likely those are not related to cancer. Cancer has a tendency to move to bone in the spine, shoulder, scalp bone, hip, or pelvic area. So if you have pain on those area, including like back pain from the neck to like below, or hip pain, or shoulder pain, which is persistent, which is not explainable by some other thing. Suppose you have you broke your shoulder like by a skiing accident, you'll have a shoulder pain. Am I right? But
Mhm.
if you didn't have in such injuries, suddenly you start to have constant pain in the shoulder, then it is a concerning symptoms, and we shall address that, And so usually also another thing to remember, like, trauma or injury related pain, they usually get better. Or arthritis related pain, they goes up and down. Cancer related pain usually persistent and progressive. That means they don't get better, they usually get worse. Okay. And another thing is that cancer related pain tends to also impact at night when people are sleeping. Normally, like, arthritic related pain, they don't bother you that much during sleeping. So if you have those symptoms, just let us know. And then what we do is that basically we do a scan of that part. Suppose someone has back pain, we do either a back CT scan or MRI, and it will show, is it related to cancer? Majority of the time, it's not, but many times it is. So it's very important to, like, to proactively report the symptoms and address that. And another important thing is that majority of the breast cancer patient from stage 1 to 3, unless you have symptoms, we do not routinely scan them in medical practice. That is the recommendation. Therefore, it's very important that patient communicate with us or with their primary care doctor, or they're educated about that what are the symptoms to look for. Okay. So one, we discussed about the bone. Other side goes is lung. So some people have dry cough or shortness of breath. These are common symptoms when cancer moves to lung. In general, when patient has uncontrolled or untreated stage 4 breast cancer, they tend to be quite, they feel weak. They don't feel like eating or weight loss. These are very non-specific symptoms, but if someone has history of cancer before or no cancer and having like persistent unexplained weight loss, those things need to be addressed, like that, those things need to be investigated thoroughly. Okay. Sometimes what happened, there is a specific type of breast cancer called lobular breast cancer, which has a higher tendency, but any breast cancer can do that, move to stomach. And then you feel like your like stomach is bloated, or you are feeling like your stomach is distended, stuff like that. And breast cancer can also move to brain. So if you have headache, especially if someone has triple negative or HER2 positive breast cancer, they should be very aware of headache, because these two type of breast cancer has a special tendency to move to brain. It can cause headache, blurry vision, persistent nausea, vomiting, which is not controlled by anything, balance issue. Those things can be sign of cancer moving to brain. And therefore, we usually, each time we see breast cancer patient, ask questions which might be relevant to, like, metastatic sites.
Thank you so much. I just love how you're simplifying all of this for us. I really appreciate it. And I had like this list of questions that we had talked about, but I know that you've just been organically answering them, so I really appreciate that. So in hearing about the different tendencies of the different types or subtypes of breast cancer, what do treatment options look like for those diagnosed with stage 4 breast cancer versus those who are diagnosed with a different breast cancer? So breast cancer and they've gone through treatment, and all of the things. But with stage four, it's pretty much ongoing, right? And so can you kind of tell us what that looks like and what does that mean?
Okay. It's a great question. So the goal of treatment, the most important, so there is lots of misconception, obviously, about any cancer. So one of the very important concept is goal of treatment for any cancer treatment, okay? For breast cancer, the goal of treatment for stage 1 to stage 3 is different than stage 4 breast cancer, okay? So stage 1 and to stage 3, our goal of treatment is basically to achieve cure. That means that will prevent metastasizing, or this cancer doesn't come back ever, and then usually we try to give treatment for a limited period of time. Depending on the type, it can be very long, up to 10 years. But our goal is to give treatment for limited period of time and then stop treatment, and goal is to cure the patient, okay? But stage 4 breast cancer is little different. It means that cancer has already spread it to other part of the body. Currently, we cannot cure stage 4 breast cancer. So majority of the breast cancer patient who has unfortunately stage 4 breast cancer will succumb to it. So our goal, but the major misconception about stage 4 breast cancer, I think, would be this one, which is if someone has stage 4 breast cancer, it's a deadly disease, but you are not going to die today or in near future. It's a very treatable disease, So with current treatment that we have, like hormone receptor positive breast cancer, majority of them will be living more than 5 years. For HER2 positive breast cancer as well, we'll be living more than 5 years. And then for both HER2 positive and estrogen receptor positive tumor, stage 4 breast cancer also will be living more than 5-7 years. We have one sore point that we don't do very well is triple negative, but people vary from each other very significantly, So like all the stage 4 breast cancer are treatable. Prolongation of the life, that means living longer, is the goal, And other important thing is that for any cancer patient, which is particularly true for stage 4 breast cancer patient, is maintaining a quality of life, So because it's basically a lifelong business, So we want patient to be like to make out of maximum of their life, instead of just coming back and forth in the hospital. Okay, so how it works usually for stage 4 breast cancer patient treatment. So obviously, when you have suspicion that this person may have a stage 4 breast cancer cancer, we usually recommend to do a biopsy to to confirm it's a stage 4 breast cancer or not. Sometimes we can get surprises, So we usually recommend the biopsy. Biopsy will confirm that is it a cancer or not. If it is it a breast cancer or not, But very rarely it could be like, some infection or some other cancer. So it's very important for us to know that there is another purpose of doing a biopsy. Breast cancer can change its character. So someone had a HER2 negative breast cancer like 5 years ago, and it came back as stage 4 breast cancer. Sometimes around 5 to 10% of the time, it can change its character and become HER2 positive. So we also do those markers in the metastatic site again. That helps us to plan the treatment. Okay, so we do biopsy, and then we will be starting treatment, which will be the most appropriate for that situation, And it varies very, very significantly depending on what subtype of breast cancer you have. Okay, so suppose estrogen receptor positive breast cancer and HER2 negative, we usually start combination of 2 pills, and they're very well tolerated, and this patient do very well on those pills. But for HER2 positive breast cancer, sometimes we start with like IV medicine, but they're very well tolerated. And one of the common medicine we use called Herceptin or trastuzumab, another is called Prajeda. Those are really helpful. For triple negative breast cancer, most of the time we start with chemo, But one concept is that once we start treatment, we'll be doing intermittent scan, usually between 8 to 12 weeks, sometimes even 4 to 6 months, to see whether they're ongoing, getting response to this treatment that they're currently on or not. And what happened over the time, it's not when. It's not like will happen or not. It is when. At sometimes the current treatment stop working, most of the cases. In such situation, we either do next biopsy or just change the treatment to different kind because cancer cells, they constantly change their characteristics. So cancer cell, which are kind of like amenable to current treatment, over years, they will change characteristics to something else that this current treatment would not work for them.
Thank you so much. And I know you mentioned a little bit about some misconceptions just about the timeline of things. What are some other misconceptions or misunderstandings that you've seen individuals have when it comes to stage 4 breast cancer that you would kind of like to clarify in this space?
Okay. So one thing we actually frequently see is stage 4 breast cancer, the rule of surgery and radiation is mostly palliative. But a lot of people think that removing the tumor will cure them. It does not. So for stage 1 to 3, surgery or removing the tumor is very important. But for stage 4 cancer, even if you, because it has spread it, So one of the thing is important to understand is that we only see the tip of the iceberg in the scan because cancer cells are very small. Stage 4 cancer means that the small cells has moved and I can see it in the scan right now, But there are small cells which are not visible in the scan also is in our body if someone has stage 4 cancer. So removing like breast or removing that area of metastasis that is visible under the skin is not cure, because there are small baby cancer cells are in the body and they will just pop up as soon as you stop your treatment. So the most important treatment or type of treatment for stage 4 breast cancer is basically a systemic treatment. That means you take it by mouth or take it IV or like under the skin that goes everywhere in your body and kill cancer cells. Because stage 4 by nature means that there are lots of cancer cells in the body that we do not see. So surgery has very minimal role in stage 4 cancer. We do sometimes. Suppose someone has a bad wound, we can do surgery or radiation that will help healing. Or someone suppose have constant back pain from cancer, which is a common symptoms, then we can do radiation and help with her pain, Or someone is breaking her back, they can, like orthopedic surgeon or spine surgeon can fix it. These are the rule that surgery or radiation have, which is basically palliation. So, but surgery or radiation will not cure stage 4 cancer. Okay?
Thank you so much. This has been just such a wealth of information. And I know that we could kind of go a long time talking about these things, but one final question that I have for you is, how does the diagnosis of, because I mean, essentially stage 4 doesn't get to that point where some people are like, I was diagnosed 20 years ago and I'm in this phase of my life. I'm done with hormone treatment and all of the things. But that doesn't necessarily happen for stage 4. So can you kind of tell us what does the longevity of treatment look like for those individuals and how it can impact their life?
So most of the stage 4 breast cancer patient will receive treatment throughout their life. Okay. Therefore, it's very important that we manage their side effect very well because it's one of the most important priority. If you think that treatment of breast cancer or stage 4 breast cancer is basically a table, it has two pillar. One is like treatment of cancer, another would be quality of life. Okay, so another thing that we don't discuss a lot. So for stage 1 to 3 breast cancer, sometimes we give a lot of treatment together, like a lot of chemo together, 2, 3 types of chemo together. But we can do it because we do it for a short period of time, you know. But for stage 4 breast cancer, we usually give one, sometimes maximum 2 treatment together. Okay, so that it's more tolerable. And there was research also that giving a lot of treatment versus 1 by 1 treatment, actually 1 by 1 treatment was better for stage 4 breast cancer. Okay, so during this breast cancer treatment time, how would be my life? You know, it's very variable depending on patient, depending on what treatment they're on. I have some patient, and it's very true, they work full time and have small kids or lots of other things when they're receiving stage 4 cancer patient. Okay, but we have also patient who have like lots of symptoms. Some patient has a lot of symptoms from the beginning. They might have more symptoms. Okay, and also treatment has different type of toxicity. Some treatments are very well tolerated versus some are not. So it's extremely variable. But saying so, as the days go by and we keep changing treatment or adding more treatment, people feels more tired, you know. So this is one thing. Then also some of the other side effect could be accumulative, like neuropathy, stuff like that. So in general, my advice is we usually tends to either lower the dose or add some medicine to make the life reasonable. And tiredness, mostly you have to take rest and use the energy strategically, you know. And but yes, one of our goal would be to making the life as reasonable as we can make.
And it sounds like, it helps to just tell your doctor what your symptoms are so that
Uh-huh.
you can address those things as they kind of come with treatment.
Which is extremely important. So, there are a few symptoms people don't want to discuss. One of them would be like, anxiety or depression, which is like you're supposed to have anxiety or depression if someone has a stage 4 breast cancer, you know. So feel free to reach out because there are lots of resources available, you know. Then
Mhm.
also relationship issue, even like sexual problem, people don't want to discuss those things. And then another important thing people don't want to discuss is money, because cancer is an expensive disease and it kind of drains you out. And also there are lots of resources available around for that. And other symptoms, like you should definitely discuss about like, manageable symptoms like nausea or vomiting, no patient or pain. These are the 3 common symptoms. No patient should suffer from them because we have treatment for those symptoms, Nausea is very well easily tolerable, easily treatable, and then pain as well. And other symptoms people always struggle with, I face, one is constipation. And also people don't want to address that or talk much about it. And then like lack of appetite and fatigue.
Well, thank you so, so much, Dr. Jahan. This has been wonderful, and I know that your wealth of knowledge can keep us here for a while because I have so many questions. But for the sake of time, I really appreciate you carving out this hour in the day to talk about this really important topic. At Forge, we serve so many individuals with stage 4. We're seeing it even popping up in women who are younger and younger. I think that the youngest I've heard was 28 diagnosed with stage 4. And so I would just thank you for the work that you do and thank you for taking the time out to answer some of these questions.
You're welcome.